Well, thank you everyone for joining this month's monthly webinar. My name is Donnie. I'm one of the QA and trainers here at ViaQuest, and I'm going to be the trainer that's going to be leading you guys through our webinar training today. So our training today is going to be on separating grief from depression. So the objectives of this training today is going to be to identify relationships between depression and bereavement, define and be able to identify triggers, key and associated features, and duration for acute and prolonged grief disorders, differentiating between prolonged grief disorder, PGD, and major depressive disorder, MDD, and review effective treatment approaches for both depression and grief. So I first want to start off by defining what grief is. So the American Psychological Association, APA, defines grief as the anguish experienced after significant loss, usually death of a beloved person. Grief can also occur after losing a pet, a relationship, your job, your health, or anything else that is important to you. So symptoms of grief often include separation anxiety, some confusion, obsessively living in the past. In severe cases, grief can become life-threatening, whether by reducing immunity, making us more susceptible to illness or disease, or by leading to suicidal thoughts. So with grief, this lessens over time. It does have some difficulty accepting whatever caused the grief. It is excessive focus on the episode of grief or avoidance altogether, and thoughts of joining that deceased. So we're going to break this down a little bit more in training here, but I also want to discuss and define what depression is. So depression is defined by the APA as extreme sadness or despair that lasts more than days. So in addition to making it harder to engage in one's typical daily activities, this mental health condition can show up in the body physically via pain, weight changes, gain or losses, sleep issues, and fatigue. So now we define what grief and depression is. Let's talk about the process of grief. Now, grief starts out small. So the first beginning part of grief is what we call acute grief, and then it transitions into what we call integrated grief. And then that goes into two separate conditions requiring clinical attention. So prolonged grief disorder, PGD, which is when transition is integrated, grief is derailed, and then major depressive disorder, so MDD, so not necessarily linked to grief, but can be exhibited by grief and bereavement. So those are going to be the two that we're going to kind of discuss today. So I have an image here that I want to discuss. And so here's a photo that outlines the differences and similarities of grief and depression. Grief and depression are similar emotional responses. With that said, each is also have their own distinct experiences. So there are quite a few similarities between grief and depression. This can make it difficult to distinguish the two. One similarity is their causes. Grief is a result of a loss and trauma. This is also same and true for depression as well, although this condition is often a result of several factors, including genetic and environment, and it can also be instigated by trauma or loss. So when we look at the similarities and we look at intense malnese, this is the general ill feeling, and then malnese is a general feeling of discomfort, illness, or lack of well-being. So while grief and depression both have their differences, they are both also similar. And this is why sometimes people can confuse grief with depression. Now, with grief, it is always, the start of bereavement. Now, bereavement is the experience of losing someone important to us. Now, it is characterized by grief, which is the process and the range of emotions we go through when we experience that loss. Now, bereavement is a natural part of life. Even we experience this many times throughout our life. Of all the events and stressors in our life, bereavement may be the most powerful impact that relates to grief. Now, bereavement refers to a response one has when they lose someone close to them. So the psychobiological response to bereavement refers to the complex interplay or psychological and physiological changes that occurs in the body following that loss of a loved one. Now, this often manifests as intense emotions like sadness, anger, yearning, alongside emotions, and also alongside some physical symptoms like disrupted sleep, changes in appetite, and an altered immune function due to stress or hormone fluctuations. Now, when we talk about acute grief, this is the initial step to grief. This refers to the intense emotions response that occurs immediately following the loss of a loved one, often characterized by shock, disbelief, sadness, and a range of strong feelings. Essentially, it is the first wave of grief experienced after that bereavement. So you get the bereavement, you lose the person, and then you go into that acute grief. Now, this is when we move into a more permanent response, which is considered integrated grief. So we start with acute grief, which is our initial response, and then we go into integrated grief. So again, this is when we move into a more permanent response, which is considered integrated grief, and it's characterized by a more manageable and less intense form of grieving, in which now we start to develop that acceptance of that reality of that loss and can begin to try to cope with that loss. So then complicated grief is more prolonged, a very intense and persistent state of mourning that can make it difficult to heal and return to daily life. So we start with the bereavement with the process. You start with acute grief, which is our initial response. That goes into integrated grief, and then you go into complicated grief. So we're going to break down these different forms of grief here in our next couple slides. So there are three forms of grief. There's acute grief, which I mentioned that is that initial stage. Then it goes into integrated grief, which becomes more permanent, and then prolonged grief. And then prolonged can be difficult to return from. So we're going to, again, break these down in our next couple of slides and talk about each one of these forms of grief. So starting with acute grief, bereavement usually triggers an acute grief response, meaning the state of experiencing a loss through death typically triggers an acute grief response, which is a period of intense and immediate emotional pain and disruption following the loss of a loved one. Now, during the acute grief, a person often experiences feelings of hopelessness and disconnections from others. As the intense sadness and yearning for that lost person can also lead to a sense of emptiness. Some people may begin to isolate themselves from everyone, making it difficult to engage in daily life or social interactions, or even things that someone used to like doing, they now don't like to do, or they don't have any interest in doing anymore. Acute grief also has some historical ties to acute stress disorder. Acute stress disorder is a short-term mental health condition that occurs within the first month after experiencing a traumatic event. And it also involves responses like anxiety, which is that intense fear of helplessness. Some people may also experience some flashbacks or nightmares, but this is all a part of that acute grief cycle. Now, grief is significantly influenced by social, religious, and cultural norms. As these factors shape how people are expected to express their grief, how long they should mourn, and what rituals or practices are considered appropriate in the face of loss. So, some common features and challenges of acute grief are shared by most individuals who experience grief. Now, when we talk about acute grief, it is not a linear process which has concrete stages or boundaries. Rather, it is a composite of overlapping and fluid conditions, which is also can be known as fluid intelligence, which is the ability to think quickly, adapt, and solve new problems without relying on prior knowledge. Some people may even experience emotions and behaviors that vary across different individuals and even in the same person after a different loss over time. So the way one person may grieve may not be a way another person may grieve. This all goes into different religions, different cultural norms that they may have. So like I mentioned, one person may not grieve the same as another person. So now that we talked about a little bit about acute grief, let's talk about integrated grief. Now, grief following bereavement is widely recognized as a painful experience, often accompanied by significant emotional distress, as well as physical symptoms or somatic distress like chest tightness, fatigue, appetite changes, and difficulty sleeping, which can vary greatly from person to person, depending on the nature of the loss and the individual's coping mechanisms. Now, mourning is the process of adapting to that loss, and this process can transform acute grief into what we call integrated grief. But we must also understand that mourning or not being okay after experiencing a loss is a normal part of this process. Mourning is the process of adapting to that loss, and now we move from the acute grief, that initial stage, into a more permanent integrated grief. And then most individuals don't know how to adapt to that loss, right? So ultimately, this continues. This is a continuous over our lives without professional assistance. So if someone moves from acute grief to integrated grief and they are stuck in that, they may need some professional help to help them move past and start to accept that grief. So adapting to loss is coming to grips with the reality that your loved one is no longer with you, which is also going to be hard for some people in this stage to understand or even to come to terms with. Now, when mourning is successful, the painful and disruptive experience of acute grief transforms into an experience of integrated grief that is bittersweet but no longer all consuming. So, in integrated grief, individuals who are bereaved recognize what the loss has meant to them and that they are once again capable of experiencing happiness and meaning. So, now that I'm not so much mourning the loss, now I can come to terms with the loss and now develop new ways to cope and remember the good times and all the good memories of that loved one. So, sometimes when people go into their bereavement or their grief process, they are not present. So after mourning is successful, they can now be more present, more open, find better ways to cope, and just develop those good practices to help accept that death or that loss. Now, looking at prolonged grief disorder. So in the past, it was often called complicated grief. And it's also called persistent complex bereavement disorder in the DSM-5. So a significant portion of people experiencing grief, roughly 7 to 10% of the bereaved population, may not progress naturally from the initial intense stage of grief, so acute grief, to a more integrated state where they can accept the loss and continue to move on with their lives, potentially becoming stuck in a prolonged grieving process due to various factors. So again, everyone isn't able to move out of that acute grief and be accepting. It takes some people a little bit longer than others to do that. Now, for these individuals, maladaptive thoughts, feelings, and or behaviors derail both adaptation to the loss and restoration of a life with meaning, joy, and purpose. Now, this is an individual who is experiencing complicated grief, a state where intense and persistent grief reactions, including maladaptive thoughts, feelings, and behaviors, prevent them from adapting to that loss or being able to move forward in a meaningful way after that bereavement. Now, prolonged grief disorder may follow the loss of any close relationship, but occurs more often in parents who have lost a child and after a death of a spouse or a romantic partner. It is more likely when the death is unexpected, sudden, or violent, such as after suicide, a homicide, or an accident. Now, in grief, healing is stalled in bereaved individuals who have prolonged grief disorder appear frequently frozen in grief. Persistent with intense grief, lasting more than what is considered typical by social norms. So, with the ICD 11 defining this period at least 6 months, and then the DSM 5 TR at least 1 year following the loss. Now, many of the features noted in the acute grief section above in a heightened state characterized by prolonged grief disorder. Now, with the key difference being the persistent intensity without a substantial trajectory towards adaptation of that loss. So, people who experience prolonged grief disorder exhibit many of these same grief symptoms as someone experiencing a normal acute grief process. But with a much greater intensity and duration, where the grief does not naturally lessen over time and significantly impacts the ability to adapt to that loss. So essentially, leaving them stuck in a state of intense mourning. So now, while prolonged grief disorder can develop after a loss of any close person, it is statistically more prevalent in parents who have lost a child, and again, individuals who have lost a spouse or a romantic partner. So multiple factors appear to increase the risk of prolonged grief disorder, including depression, anxiety disorders, current substance use or abuse, multiple losses, particularly stressful circumstances surrounding the death, the lack of having a support system, uncertainty about the death, and the unavailability of usual mourning rituals. So, in a sample of 206 individuals with prolonged grief disorder, 75% were diagnosed as having a current comorbid psychiatric condition. In this sample, the most common comorbid conditions were major depressive disorder, which was 55%. 48% of those people developed PTSD. 62% of those people developed anxiety disorders. And then with general anxiety disorders being the most common anxiety disorder comorbidity. So 18%. So out of those 206 individuals, 75 were diagnosed as having a psychiatric condition. So now that we talked about prolonged grief disorder, in some way how it develops, let's talk about the evolution of prolonged grief disorder. So, a significant minority of individuals will experience unrelenting bereavement responses resulting in functional impairment beyond cultural norms. So, which historically has been labeled complicated, traumatic, persistent, or pathological. However, most recently, the consensus name is prolonged grief disorder. Now, this is where a portion of people experiencing grief will continue to experience intense and debilitating emotional distress following that loss, significantly impacting their daily functioning, exceeding what is culturally considered normal. And with this condition, it is now mostly commonly referred to as PGD. Now, prolonged grief disorder is characterized by elevated and persistent mental distress following the loss. So, some factors that contribute to prolonged grief reactions are maladaptive thoughts, which is placing that blame on other people or themselves, having that avoidance behavior, the inability to manage painful emotions, differences in health and social status, and lack of social support that interferes with the adaptation of that loss. There we go. Sorry about that. So continuing on with the evolution of prolonged grief disorder, PGD is linked to negative outcomes and is associated with the increased risk of all-cause mortality, meaning a higher likelihood of death from any cause. This is due to the significant psychological and physical impacts that prolonged grief disorder can have on individuals' health. It is also associated with higher risk for suicidal ideations and behaviors, and the behaviors with prolonged grief disorder is linked to negative outcomes and is associated with an increased risk of all, meaning that the likelihood of that death can cause a more significant grief for that person. So now we have a little table here that is differentiating prolonged grief disorder from major depressive disorder. So clients with personal history of depression and those with genetic predisposition are more likely to experience major depressive disorder than those without. So we look at the table here, looking at the core features of prolonged grief disorder. That is the loss, the yearning, longing, and thoughts and memories of that deceased. Whereas major depressive disorder, that is dysphoria and or anhedonia. So in grief, the prominent effect is the emptiness and loss opposed to that persistent depressed mood, anhedonia of major depressive disorder. Anhedonia is the lack of interest, enjoyment, or pleasure from life experiences. So when we look at dysphoria, in grief, dysphoria decreases in intensity over days to weeks and occurs in waves that are associated with the thoughts and reminders of the deceased. So, in contrast with major depressive disorder, the dysphoria tends to be persistent and is not tied to specific thoughts or images. Then we look at the guilt with prolonged grief disorder. This is typically centered on deeds done or not done in relation to that deceased. Whereas you look at major depressive disorder, these are more tied to feelings of worthlessness or being undeserving. So, as we know, major depressive disorder and prolonged grief disorder has a lot of similarities, but when you look at different features or different items, they both pose their differences here. So we're going to break down a little bit of what causes prolonged grief disorder, and then we're going to talk about some derailers here. So what causes prolonged grief disorder? So, when the process of adaptation is derailed by a patient's inability to integrate grief, the result is prolonged grief. Disorder with persistent, pervasive yearning, longing, and preoccupation that impairs functioning. So, the clinical syndrome of prolonged grief disorder contains symptoms of persistent acute grief with one or more derailers. And so, we'll get into derailers for a few, but let's discuss the differences between prolonged grief disorder and major depressive disorder. All right, so when we look at prolonged grief disorder and major depressive disorder, we look at focus. Now, while both prolonged grief disorder and major depressive disorder involve sadness and distress, the key difference in focus lies in the specific preoccupation of that thought. So, in prolonged grief disorder, the primary focus is intensively yearning for and ruminating about the deceased person, while major depressive disorder focuses on more generalized, often centering around negative self beliefs and permissions about the future, not necessarily tied to a specific loss. So, for prolonged grief disorder, this is more global focus. When it comes to focus, prolonged grief disorder is more global focus on negative responses to oneself, the world, and future, whereas major depressive disorder is strongly focused on the response to changes resulting from the loss of that loved one. Now, when we look at core symptoms of prolonged grief disorder versus major depressive disorder, who can tell me which one defines major depressive disorder and which one may be prolonged grief disorder? So you can unmute yourself, or you can put in the chat if you want to. But which one is prolonged grief disorder and which one is major depressive disorder? Anyone? All righty. So when you look at prolonged grief disorder, when it relates to core symptoms, yearning, longing, or preoccupation of that disease, whereas major depressive disorder, that is the sadness or permanent loss of interest or pleasure. So again, this lies within the core symptoms, while prolonged grief disorder is primarily characterized by an intense, persistent longing and yearning. Major depressive disorder is defined by a more generalized, the loss of interest in activities, feeling of worthlessness, and not necessarily tied to a specific loss. So this can be more than one loss that this person may be feeling. All right, let's look at guilt as it relates to prolonged grief disorder and versus major depressive disorder. So one is guilt focused on relationships, guilt of omission, like if only, or on survivor's guilt, which entails a general feeling that it is wrong to be alive and flourishing when a loved one has died. And then the second one may be generalized feeling of guilt, focus on perceived deeds, committed with malevolent intent, did something bad or wrong. So, who can tell me which one is more prolonged grief disorder and then which one may be major depressive disorder? All right, guys. Well, that first one there, guilt focused on relationships, guilt of omission, that if only, that is prolonged grief disorder. And then, of course, the other one is major depressive disorder, generalized feeling of guilt, focused on perceived deeds, committed to the malevolent intent, I did something wrong or I did something bad. All right, let's look at enhodynia. So, again, the difference between or versus prolonged grief disorder versus major depressive disorder. So, one is deficient in the capacity to experience positive emotions, part of the neurobiology of this disorder. And then the other maintains the capacity to experience positive emotions, including pleasant memories of the loved one, pleasurable reversaries, appreciation of loved ones, and current distraction. So, does anyone know which one is prolonged grief disorder or which one is major depressive disorder? All right, so having the deficient in the capacity is prolonged grief disorder, and then maintains the capacity to experience those positive emotions is major depressive disorder. So again, in prolonged grief disorder with anhedonia is often restricted to activities related to that decease, while major depressive disorder in anhedonia is more pervasive is more pervasive and affects a wider range of life experiences, leading to that general lack of interest and previously enjoyable activities. So again, sometimes prolonged grief disorder can be mistaken for a major depressive disorder. So looking at suicide, someone experiencing, so death may be seen as an escape from pain, seeing themselves as a bad person, or to relive the burden they feel they place on others, or to relive the world of the person who is worthless, or related to the absence of the person who died, wanting to join them or not wanting to live in the world without them. So who can tell me the difference here? Or which one is for prolonged grief disorder? Which one is for major depressive disorder? Alrighty, so for major depressive disorder, this is related to the absence of that person who died, wanting to join them. And then for prolonged grief disorder, this is death may be seen as an escape from that pain, seeing themselves as a bad person. And so someone experiencing prolonged grief disorder might be more likely to have suicidal thoughts related to wanting to join the deceased, whereas someone with major depressive disorder might have a broader suicidal thought stemming from their overall depression. Now, when we look at avoidance, for prolonged grief disorder, this is common. So focus on avoiding reminders of the loss, situations that activate that grief, whereas major depressive disorder is not common. When present is related to the general loss of energy or interest or self-doubt. Now looking at proximity seeking. So for prolonged grief disorder, this is positive reminiscing. It is not common. That yearning and longing is not common. Major depressive disorder is positive reminiscing is not common. Yearning and longing is not common, whereas prolonged grief disorder is prominent yearning, longing, positive reminiscing is common. Looking at healing. So for prolonged grief disorder and major depressive disorder, healing entails adapting to the changes brought about the loss. And then for NDD, healing entails restoring positive mood, energy, and capacity for positive emotions. So as we have seen in these last couple of slides, that prolonged grief disorder and major depressive disorder does have a lot of similarities. However, they are different in their own way. So now that we've talked about the differences, let's talk about some derailers. So a derailer is a weakness that requires improvement if we are to realize our potential. You can recognize a derailer by using these four criteria. So a derailer has the potential to limit our progress. Sometimes a derailer has the potential to sometimes a derailer can be linked to a talent taken to an extreme. So multiple strengths cannot compensate for a derailer. So some derailers, the first one there is disbelief or protest. This is kind of like a mental rejection of something that is untrue. Counterfactual thinking. This is the tendency to imagine how events could have been different. It's often described as the phrase "what if" or "if only." Misunderstanding grief. This is the idea that it has a timeline, that it should be kept private, and that it could be gotten over. Placing blame on self or others. This is very common. This is a very common experience, often considered as a part of a bargaining stage, whereas the individuals try to make sense of the loss by assigning fault, whether it be to themselves or others involved, even when it is not logically justified. Then you have survivor's guilt. That is a feeling, that is a feeling of sadness or guilt that can occur after someone survives a traumatic event while others did not. Feeling unable or unwilling to adapt. I can't go on life without them, or being unwilling to adapt to that loss or move on in life. Cautious about close relationships. So someone is hesitant or weary about forming deep, intimate connections with other people, often due to past experiences of hurt or fear or vulnerability, or a general distrust in other people. And then lastly, there is avoidance of emotional pain. So this is a common reaction to trauma. So finding a way to escape that pain or that painful or difficult emotion. So these are some derailers. Let's talk about some risk factors for derailers, and then we're going to kind of have a video for us to watch pretty soon here. So looking at some risk factors for derailers. So risk factors that can increase likelihood that grief elements will become derailers. So they are grouped as personal risk factors, relationship risk factors, circumstance risk factors, context risk factors, and consequence risk factors. So risk factors are the to increase the likelihood that a potentially problematic early grief response will be more difficult to manage. And this also increases the likelihood of prolonged grief disorder. So now let's break down these risk factors here and talk about them a little bit more. Now, the first one there is personal risk factors. Now, personal risk factors refers to behaviors or personality traits that can hinder career progression. This includes excessive ego, lack of self-awareness, poor emotional regulation, the inability to adapt to change, overcome competitiveness, taking too much credit. Someone may have poor listening skills, lack of empathy, and unwillingness to accept feedback, essentially behaviors that prioritize personal gain over the collective good and damage relationship with colleagues and supervisors. So prior history of multiple losses, difficult early caregiver relationships. Then we're looking into relationship factors. This can be like a death or a child or a spouse, a highly rewarded relationship with the person who died. And this is being able to connect with someone on a deep level, have rewarding experiences together, and being able to make someone feel happy and special. So that's kind of someone or those people in those highly rewarded relationships. This can be a spouse. This can be different relationships in that person's life. This can be grandparents, close friends, best friends. So depending on who they consider as a highly rewarded relationship, these are some relationship factors here. Now looking at circumstance factors. Looking at violent or other sudden unexpected death. Now this is death that occurs rapidly and without warning, often due to traumatic or forceful causes like accidents, homicides, suicides, or certain medical conditions that can lead to sudden cardiac arrest, leaving little or no time for any intervention. Now, perceived injustice surrounding the death. This is a multidimensional concept that involves a sense of unfairness, blame, and the severity of that loss. It can have a negative impact on mental health and recovery, especially in the context of pain. And then the death of a young person is always a difficult experience. This can cause a range of emotions for someone, including shock, denial, anger, panic. So grief can be especially intense when a child dies, and the parents often experience that very, very enduring stress. So caregivers, especially if they are caring for a partner or have experienced depression before that loss, are also at greater risk. So the risk for prolonged grief is also greater when the death of a loved one happens very suddenly or under traumatic circumstances. So looking at context, context factors. So stressful or unsupportive environments, this refers to a social setting where individuals consistently experience negative interactions, lack of emotional support, hostility, criticism, leading to a heightened stress levels and potentially impacting their mental health and physical well-being. Financial, housing, or employment problems. So if there is a job shortage, Racial discrimination, financial health, all of these play a role in those context factors. So when we talk about job shortage, this is the shortage of good jobs that meet workers' needs, including economic security. When we talk about racial discrimination, can pose a barrier to employment and economic mobility for people who experience homelessness. And then, as always, that financial health. Financial health affects and is affected by every aspect of a person's life, including where they live, where they work, how healthy they are. So these are some context risk factors here. And then next is going to be consequence factors. So the loss of the social connection. So a lack of social connections can lead to loneliness and social isolation, which can increase the risk of serious mental and physical health conditions. So looking at loneliness, this is the feeling of being alone, disconnected, or not close to others. And then that social isolation, so not having relationships or contact with support people. Now, economic insecurity is the uncertainty of maintaining a stable income to meet basic needs. So the loss of income can be a trigger for economic insecurity, which can lead to a number of challenges. So now that we've talked about a little bit about prolonged grief disorder, we talked about the differences between major depressive disorder and prolonged grief disorder. Now we want to talk about how can we help or how can we cope with grief. So I have a little 5-minute video here that I'm going to have us watch, and it's going to kind of help us with coping with grief. Hopefully it comes up. There we go. Can everyone hear my sound?
You might need to share your sound, Donnie. I don't hear anything.
Thanks, Kim. Okay.
Yeah.
Let me reshare. Sorry about that. Okay. Sorry, let me start it over.
Speed up your website copy with an AI text generator that delivers a consistent brand.
Sorry, guys, I'm trying to skip this. It's not letting me hit the skip button.
Voice to every corner of your site.
Sorry, guys, let me get that fixed really quick. My apologies. So sorry, guys.
I want to talk about it.
You need to talk to
At some point in our lives, we will be faced with the realization of our own mortality. As hair begins to gray and our bones turn frail, we begin to understand that life, as precious as it is, must inevitably come to an end. We all go through the grieving process in our own ways. There is no universal method for healing. If you've dealt with this kind of loss, you know that the healing process sometimes feels impossible. You might feel like this lingering feeling will remain with you forever. You may hear the familiar bells of their favorite song or catch a faint scent that reminds you of their cooking. We hope that these few techniques can relieve that pain and help you move forward while honoring their lives. There's no quick fix. Dealing with grief isn't some scientific problem that we solve. Grief is an incredibly complex emotional journey, and it isn't a process that we should rush. We're not suggesting that grief is something you can fix by watching a quick YouTube video. It's definitely not that simple. So as you watch this video of techniques to relieve your pain, understand that it's never as simple as a step-by-step guide. If you feel overwhelmed, there are professionals, family, and friends that you can reach out to. You are not alone. Acceptance. Okay, so this is obviously much easier said than done. Accepting our grief sometimes feels like a battle in our minds. Part of us just wants to reject that reality of what has happened. And sometimes we reject our deepest emotions, which burn and twist deep inside of us. But it's important not to let yourself become numb. Own those feelings and understand why you're feeling them. Let them flow through every fiber of your body. Remember, there are no right or wrong feelings. It's okay to feel everything that you're feeling, even if it's confusing or disturbing. Companionship is key. The people around us make a huge difference when we're dealing with grief, but as many experts have noted, they can either help or hinder our healing process. There are those who try to fix our grief, encouraging us to get over it. This obviously isn't very helpful. The best companions during these dark times know how to listen. Sometimes there are no words to express how we're feeling and no words to reassure us, and those people understand this. These people are just there for us, whether it means providing a distraction or lending a shoulder to cry on. Use art as an outlet. Those deep, heavy feelings of grief aren't just going to disappear, but you can channel those feelings into something creative. And art is one of the most helpful healing methods. In her book, It's Okay That You're Not Okay, psychotherapist Megan Devine recommends taking those emotions and pouring them into a painting, a graphic novel, or any other art form that gives you an outlet. Artistic expression lets you get grief off your chest, as it's a form of emotional release. Write a journal. Sometimes it's easier to keep silent rather than express our emotions. However, most psychologists agree that it's not a good idea to bottle everything inside. If art isn't your thing, keeping a journal is a great way to understand our emotions, including his grief. When writing our emotions, we confront, dissect, and ultimately come to terms with them. Based on the research on journaling in the psychological community, we understand its benefits, especially if you write over the course of multiple days. You don't have to share your journal with everyone, and that gives you total freedom to truly express yourself. Create your own rituals to honor those who have passed. We don't mean shamanistic rituals that involve intermediaries or ancient traditions. These rituals can be anything you want them to be. Dr. Kim Bateman, a clinical psychologist, encourages us to think about what made our loved ones happy when creating our own rituals. Maybe your loved one really enjoyed a specific type of tea. Your ritual could be something really simple, such as pouring your loved one a cup of tea and thinking of a memory of them while their cup sits and steams. It doesn't matter what you believe in. This is just a way for you to honor their memory, plain and simple. Don't trust in the 5 stages of grief. Most of us are familiar with the so-called 5 stages of grief. This was introduced to us by psychiatrist Elizabeth Kubler-Ross way back in 1969. And while it's definitely an interesting model, the entire concept is now a little outdated. Most modern psychologists agree that grief is not a linear process, and it can't be summed up as a simple equation or formula. Grief is experienced differently by everyone. Focus on how you are healing presently without anticipating what the next stage of this process may be. If you found this video helpful at all, please let us know in the comments.
Alrighty, so to bring my PowerPoint back up, guys. Alrighty, sorry about my sound and everything. All right, so now we're going to go into talking about how to cope with grief. So take care of yourself. Try to exercise regularly, eat healthy food, get enough sleep, avoid habits that can put you at risk, your health at risk, like drinking too much alcohol or smoking. As always, talk to a caring friend. Let others know if you need to talk. Join a grief support group in person or online. It may be helpful to talk to people who are also grieving, whether it's the same as you or they're just grieving, period. It's also good to talk to people. Talk to your doctor. Be sure to let your healthcare provider know if you're having trouble with everyday activities like getting dressed, sleeping, or fixing meals. Now, how to cope in adapting to loss. Now, grief is a process of letting go and learning to accept to live with loss. The amount of time it takes to do this varies with each person. So experts say you should let yourself grieve in your own way and time, and people have their own unique ways of expressing their emotions. So for example, some might express their feelings by doing things rather than talking about them. They may feel better going on a walk or swimming or by doing something creative like writing or painting. And then for others, it may be more helpful to talk to family or friends about the person who's gone, or with a counselor or a healthcare provider. So everyone does not cope the same. So to adapt to a loss, a person needs to accept its finality and understand what it means to them. They also must find a way to re-envision their life with possibilities for happiness and for honoring their enduring connection to the person who died. Alrighty, so we're back here with some derailers here, and I have a story here that I'm going to read, and then I want to see if you guys can help me find the derailers. So the derailers are on the side. I kind of reviewed them a little bit ago. So disbelief and protest, counterfactual thinking, misunderstanding, and so on. So I'm going to read the story, and then the next couple slides, I'm going to continue to find some derailers. So Paula's husband, Will, had a severe progressive lung disease. Following his last hospitalization, he refused a medical procedure and signed himself out. He was breathless when he called to tell Paula about this, and she got annoyed with him. This wasn't the first time he had refused care and signed himself out of the hospital. She wanted to go home and get him back to the hospital, but she was visiting her dying aunt more than an hour away. Will assured her he would be okay, and she was too worried about her aunt to argue. All right, so we're going to see what these derailers are in Miss Paula's story. So Paula experienced a panic attack when a neighbor called to let her know Will died. She couldn't believe he had died and was convinced he would be resuscitated. After a year, Paula struggled to adapt. An endless flood of disbelief, protest, and harsh self-blaming or angry thoughts accompanied waves of intense feelings of guilt, anger, and fear. She thought she had been there to comfort Will. She had let him down in this moment of need. It was wrong and unfair that she had to lose him in this way. Why wasn't he rescued like always? So let's find some derailers together. So you guys can unmute yourself. You can put in the chat. But I want a little bit of participation here. Can you help me identify the derailers? So what are the derailers here in Paula's story? So whoever, you can just call out one. You can put in the chat one. So what are the derailers here? Disbelief or protest, counterfactual thinking, misunderstanding, grief, placing blame on self or others, survivor's guilt, feeling unable or unwilling to adapt, cautious about close relationships, and the avoidance of emotional pain. So someone put in the chat, placing blame on self. So correct. So she's feeling like it was wrong and unfair that she had to lose him in that way. So placing the blame on herself. Any other derailers you guys can identify? How about disbelief or protest? Why wasn't he rescued like always? He could have been resuscitated. She couldn't believe that he had died. Any additional? Feeling unable to adapt. Okay. Yeah, she doesn't know how to, she can't believe that he died, you know? And then another one is also counterfactual thinking. You know, she thought she could have been there to comfort him. She had let him down. So yeah, those are those derailers. So good. All right, next one. All right, so for years after Will's death, she was still consumed by yearning to have him back, preoccupied with memories of their life together and how wonderful it had been, and ruminating on about how and why he died. She could spend hours daydreaming about special moments with him. She avoided going to the cemetery. She avoided places they enjoyed together and stopped seeing friends, afraid that doing these things will make her miss him even more. Overcome with endless grief, this previously competent and sociable woman was isolated and barely able to function. So what are some potential derailers here? All right, so one is Survivor's guilt. She felt it was wrong for her to enjoy herself since Will can no longer be here. We have some stuff in the chat here. Survivor's guilt, yes. So she felt like it was wrong for her to enjoy herself since he was here. Also, avoidance of that emotional pain. She avoided going to the cemetery. Good, yes, avoidance of emotional pain. She avoided places they enjoyed together. Good, cautious about relationships. So she stopped seeing friends, afraid that doing these things will make her miss him even more. So good, good. Feeling unable or unwilling to adapt. So yeah, she is unable to adapt to his loss, continue to do the things that she was used to do or was doing when he was here. So great job, guys. Thanks for that participation. So yes, those are some derailers in Miss Paula's story. Alrighty, so let's talk about understanding how to treat prolonged grief disorder. And so in order to understand a person's grief, we need to understand close relationships. Bereavement can trigger the onset of major depressive disorder, PTSD, panic disorder, GAD, generalized anxiety disorder, and or substance abuse disorder. So sometimes it may make sense to treat other disorders before prolonged grief disorder. So doing some preliminary review of past psychiatric diagnosis and treatment and physical health, including suicidal thinking and behavior before the death. So things like major depressive disorder are treated with psychotherapy and medication regimens that may not work for prolonged grief disorder. However, adding medication to prolonged grief disorder therapy leads to a better outcome from symptoms of major depressive and prolonged grief disorder therapy alone. So some informed interventions for prolonged grief disorder. When formal therapy for prolonged grief disorder is not available, there is still much clinicians can do. So step one, they can include an inquiry about bereavement as a part of the initial evaluations and to have an open ear for issues related to grief and ongoing clinical management. So questions to help identify and guide the inquiry include, has anyone died close to you? If so, have you been able to grieve or adjust to life without him or her? Are you still struggling with your loss in any way? Or do you mind if I ask you more about it? So that's step one. Step two is to invite an open inquiry about the relationship, death, mourning, process, and impact to that loss. So kind of just being supportive there, non-judgmental, empathetic communication can let patients know that they are not alone and can aid in their healing process. Other components of grief-informed clinical management include symptom monitoring, affirmations to reinforce clinical support, encouragement for re-engaging in daily activities and hobbies, and then the appropriate referrals for other identified support resources. If left untreated, prolonged grief disorder is debilitating and often can be an often chronic condition. And so recognition and poor intervention can be life promoting and in some cases life-saving. So some treatment for prolonged grief disorder is CBT, which is cognitive behavioral therapy. DBT was dialectical behavior therapy, and then CGT, which is complicated grief treatment. And so for prolonged grief disorder, that is 16 sessions. And then CGT incorporates the components of attachment theory, CBT, and other approaches to facilitate that natural adaptive process to that loss. So complicated grief treatment. CGT facilitates adaptation through focus on both loss and restoration in alignment with the dual processes model of grief. The loss focus components include accepting the reality of the death and changing the relationships in which a person who has died. So the restoration focus elements including working towards aspirational goals in the absence of the individual who died and having a sense of competence and satisfaction in the world without the deceased. So updated research from Columbia Resource, prolonged grief disorder therapist guides people through 7 healing milestones in 16 sessions. By doing this, it allows the therapist to facilitate adaptation to the loss and to elicit and address stuck points. Now, these milestones include understanding grief, managing emotions, seeing a promising future, strengthening those current relationships they have, and then narrating the story of the death, learning to live with the reminders, and then connecting with those memories of that lost person. So as we've seen throughout the training today, that although prolonged grief disorder and major depressive disorder are different, they are similar in a lot of ways. And we have discussed a host of treatment options, a host of ways of how to cope with our clients or help our clients or ourselves cope with grief. So I hope that taking this training today, you guys have a better understanding of prolonged grief disorder and major depressive disorder and how they are similar. So I do want to open the floor for any questions that you may have. If you don't have any questions, I appreciate you taking this training today. And again, I hope that you have a better understanding of prolonged grief disorder and major depressive disorder. Thank you, guys. All right, you guys, thank you so much for taking this training. Have a good day.